In its spirit of driving the coronavirus from the source of the Gambia, the Red Cross Society on Monday launched its community and accountability approach at its headquarters in Kanifing. The aim of this initiative is to involve communities to actively participate in the fight against the respiratory disease. Our Makalo has more details of that.
The Gambia Red Cross Society is visibly spearheading this fight against COVID-19. They voluntarily execute the burial of those killed by the virus almost on a daily basis. But they are also empowering and enhancing the public health and socio-economic systems to minimize the effect of the pandemic in the Gambia. Speaking at the launch of the Community and Accountability Approach, Buba Dabo, the Disaster Management Coordinator of the Gambia Red Cross Society, said there was a need to involve communities to cope the spread of the virus because community transmission was on the rise.
How are we going to do this? It's very simple. Because of our response plan, we now want to engage the communities themselves. We have been talking to the radios, from TVs. We have been doing caravans ourselves, but yet still the disease is upsurging in the community. So we thought the best option now is to engage the people themselves, to talk to their people.
The voluntary organization began its community engagement approach with the One Gambia COVID response in Banjul. The outcome was positive and the initiative is being extended to other communities across the country, according to Alassane Senghor, the Secretary General of the Gambia Red Cross Society.
As you might have heard, the train had already left the station. A couple of weeks ago, we were approached by One Gambia COVID Banjul, and we started working with them through our branch in Banjul, and they were able to deliver in 2 weeks very tangible results from what you've heard from Mr. Jahate, who is the chair of the Banjul branch. And we will continue to engage. Because of that success and because of that achievements in Banjul, we decided that we need to look at, one, the context of COVID in this country. Two, as Buba rightly alluded, we have a plan, a preparedness and response plan, which is based on scenarios, but also very dynamic in the sense that from time to time, based on the context, we need to revise the plan so that it adequately addresses the needs at that particular time.
Modu Toure, the communication officer of the Gambia Red Cross Society, said they are already in touch with other local communities to inform them about the ideas of new approach to fighting the coronavirus. There are more than 3,000 confirmed cases of the virus in the Gambia, including 96 deaths, and a little over 1,000 recoveries as of 1st September 2020. For iAfrica News, I am Julden Suare.